So you can see what we're doing here is we're locating the perimeter of the muscle, and we're aiming to inject in the lower third of the muscle. This is 3 simple injections that are placed quite deep. Now it's relatively painless for the patient. Nobody tells me it's unbearable. The main thing is we tell you not to clench as we inject, and we place the 3 injections, as I've said, to the lower third. We would then bring you back at 2 weeks just to assess how effective that dose has been for you, and should you need further treatment, there is no extra cost involved. So treatment is usually very, very effective, and we place the 3 injections on either side of the masseter muscle.